Have you ever fallen asleep with your shoulder in a weird position, only to wake up with your arm completely asleep? Or hit the inside of your elbow, the famous funny bone, and cause part of your hand to go numb? This happens when we compress or bang the nerves found in our arms, all of which originate in the brachial plexus. The brachial plexus is a vast network of nerves originating from the anterior rami of C5 to T1, which extends through the axilla into the shoulder, arm, and hand, providing afferent or sensory nerve fibers from the skin, as well as efferent or motor nerve fibers to the muscles. Alright, so the brachial plexus is divided into 5 roots, 3 trunks, 6 divisions, 3 cords, and 5 terminal branches. The order can be remembered using the mnemonic, remember to drink cold beer. Additionally, there are branches that leave the brachial plexus at various points along its length. Since the branches that come off of the roots and trunks are located above the clavicle, they are sometimes called the supraclavicular branches of the brachial plexus. And since the branches that come off of the cords as well as the terminal branches are located below the clavicle, they're sometimes called the infraclavicular branches of the brachial plexus. Okay, so starting with the roots, the 5 roots come from the anterior rami of the last 4 cervical nerves, C5 through C8, as well as the anterior ramus of the first thoracic nerve, or T1. These roots usually travel between the anterior and middle scalene muscles along with the subclavian artery. These 5 roots give off some branches: the long thoracic nerve, which arises from C5 to C7 and gives motor innervation to the serratus anterior muscle, the dorsal scapular nerve from C5, which gives motor innervation to the rhomboid and levator scapulae muscles, and a contribution to the phrenic nerve from C5, which gives motor and sensory innervation to the diaphragm. At the inferior part of the neck, the 5 roots combine to form 3 trunks. C5 and C6 merge to form the superior or upper trunk. C7 remains as the middle trunk, and C8 and T1 merge to form the inferior or lower trunk. The superior trunk gives off another branch, the suprascapular nerve, which travels across the posterior triangle of the neck, which we can see here highlighted in blue, and through the scapular notch to give motor innervation to the supraspinatus and infraspinatus muscles. The superior trunk also gives off the nerve to subclavius, which gives motor innervation to the subclavius muscle. Okay, now that we've gone over the roots, trunks, and the supraclavicular branches, let's pause and do a quick quiz. Pause the video and see if you can identify them. Moving on, each trunk splits into an anterior and a posterior division as they travel through the cervicoaxillary canal, or the apex of the axilla, giving rise to a total of 6 divisions. Think of it as traveling through a wormhole, and on the other side, the 6 divisions regroup with each other to form 3 cords. The cords are named for their relationship to the second part of the axillary artery. So, lateral to the axillary artery, there's the lateral cord, which is formed by the anterior divisions of the superior and middle trunks. Posterior to the axillary artery, there's, you guessed it, the posterior cord, formed by the posterior divisions of the superior, middle, and inferior trunks. And medial to the axillary artery, there's the medial cord, formed by the anterior division of the inferior trunk. No surprises there. Now these cords sprout a number of branches. The lateral cord gives rise to the lateral pectoral nerve, which gives motor innervation to the pectoralis major muscle, and also the pectoralis minor muscle via a communicating branch to the medial pectoral nerve. The posterior cord gives rise to the upper and lower subscapular nerves, which give motor innervation to the subscapularis and the subscapularis and teres major muscles, respectively. There's a thoracodorsal nerve, sometimes called the middle subscapular nerve, which gives motor innervation to the latissimus dorsi muscle. Next, the medial cord gives rise to the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm, which gives sensory innervation to the medial skin of the arm and forearm. And more proximally, there's the medial pectoral nerve, which gives motor innervation to the pectoralis minor and major muscles. And finally, the 3 cords give rise to the 5 terminal branches. The median nerve is formed by contributions from both the lateral and medial cords and is made up of fibers from C5 to T1. The other terminal branch of the lateral cord is the musculocutaneous nerve, which receives contributions from C5 to C7. In the axilla, the median nerve is anterior to the axillary artery. The musculocutaneous nerve quickly exits the axilla by piercing the coracobrachialis muscle. The posterior cord divides into 2 terminal branches, which are the axillary nerve, which is made up of contributions from C5 and C6, and the radial nerve, which is made up of contributions from C5 to T1. The axillary nerve travels with the posterior circumflex humeral artery, which is one of the branches of the 3rd part of the axillary artery. It exits the axilla through the quadrangular space to travel around the surgical neck of the humerus. The radial nerve passes posterior to the axillary artery to exit the axilla and travel in the spinal groove of the humerus. Finally, the medial cord gives rise to 2 terminal branches, the medial contribution to the median nerve and the ulnar nerve, which is made up of fibers from C8, T1, and occasionally C7. I think you'll agree that the brachial plexus can be pretty overwhelming, so one tip for orienting yourself and finding those terminal branches is to look for the letter M that is formed by the musculocutaneous nerve laterally, the ulnar nerve medially, and the median nerve in the middle. Alright, we're almost there. Now that we've gone over the divisions, cords, and terminal branches, let's go ahead and do another quiz. See if you can identify the cords and their branches as well as the terminal branches. Since the terminal branches of the brachial plexus each have many motor and sensory functions, let's go ahead and summarize them here, starting at the shoulder joint and moving our way down towards the fingertips. First, the median nerve gives motor innervation to the muscles of the anterior forearm, except for flexor carpi ulnaris, and the ulnar, or medial half of flexor digitorum profundus. In the hand, it innervates the thenar muscles, which act on the thumb, and the lateral lumbricals. It also carries sensory innervation from the skin of the hand. On the palmar side, it innervates the lateral 3½ digits and the adjacent palm. On the dorsal side, it innervates the distal aspects of the lateral 3½ digits. The musculocutaneous nerve gives motor innervation to the muscles of the anterior arm. It then continues as the lateral cutaneous nerve of the forearm to supply sensory innervation to the lateral side of the forearm. The axillary nerve carries motor innervation to the teres minor and deltoid muscles. It also carries sensory information from the glenohumeral joint, or shoulder joint, and the skin covering the inferior portion of the deltoid. This area of skin innervated by the axillary nerve is also known as a Sargent's patch. The radial nerve gives motor innervation to all of the muscles of the posterior arm and forearm. It also provides sensory innervation to the skin of the posterior arm and forearm. In the hand, it only supplies sensory innervation on the dorsal side. Here, it innervates the lateral hand, the thumb, and the proximal 2nd to 4th digits. And finally, the ulnar nerve carries motor information to the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. In the hand, it innervates most of the intrinsic muscles, except for a couple that are innervated by the median nerve. Just like the median and radial nerves, it also carries sensory information from the skin of the hand. On the palmar side, it supplies the medial 1½ digits and the adjacent palm. On the dorsal side, it also innervates the medial 1½ digits and the adjacent skin of the hand. Let's take one more pause here before we recap. Here's a picture of the palmar and dorsal sides of the hand. Can you remember which nerves carry sensory information from each region? Alright, as a quick recap. The brachial plexus originates from C5 to T1. These 5 roots combine to form 3 trunks. Each trunk splits into an anterior and a posterior division for a total of 6 divisions, which then regroup with each other and form 3 cords. Finally, the cords divide and give rise to 5 terminal branches, which are the musculocutaneous nerve, the axillary nerve, the radial nerve, the median nerve, and the ulnar nerve.